Hi, I'm Perry Atkinson, General Manager here at theDove. Hey, check out our other videos and check out our website at thedove.us. Well, welcome to Focus Today. I'm your host, Perry Atkinson, and the doctor is in the house. Yes, we have Dr. Joel Klein with us today from Ventana Wellness, and talking about something that I guarantee you all of us deal with, stress. And that little problem in our life, Doc, that keeps us on tilt.
Well, one of the big three, and probably the major one in many respects.
We want to deal with stress and adrenal glands. But before we do, earlier today we had a news story that says the taking of an aspirin voluntarily is probably not doing much. You shouldn't do it maybe unless your doctor prescribes it. What's your thinking on that?
I haven't seen more recent data, but I've never felt like it was that strong. I mean, I remember there was maybe more of an effect in men, if there was one. I don't think it was that great, and especially the problem is with an older population. Even the one aspirin a day can contribute to stomach problems, inflammation in the stomach and all that. So I've never been tremendously impressed with the aspirin that everybody should be taking. I know friends of mine who are practitioners who did an informal study with a few of their patients. So it wasn't a big medical study, but they had a few of their patients and they tested this platelet function, which is what aspirin does. It inhibits the blood platelets. And they found that fish oil and vitamin E had the same effect as the aspirin did. But again, this wasn't a big scientific study. This was a sampling of their practice. But I don't take it. I have never been a big proponent of, that everyone should do this.
Again, fish oil and vitamin E, is that something that we should be looking at?
Well, especially if there's any problems with things. That's the thing. All the studies, they look at vitamin E studies. They don't show anything. Typically, they use the cheap, what's called DL-alpha tocopherol that you can buy by the pound, at Costco or Walmart. That's actually an artificially formed. It's not a natural form, maybe doesn't work as well. I don't think everybody needs to do that either, but to do, you need your omega-3s, and you should do, should have a decent diet where you're going to be getting vitamin E, the natural antioxidants that are in all our fruits and vegetables and all these wonderful things.
Okay. All right, let's talk about stress and adrenal glands, a topic that we hit on quite regularly, but let's do with some basic things. What is the adrenal gland?
So the adrenal gland, adrenal, is Latin for on top of the kidney. So that's where that, another fancy term, demystified. And there are small walnut-sized glands that sit on top of the kidneys that are responsible for the production of most of our hormones that have to do with adapting to change in the environment. Particularly that are the issues. Obviously, there's adrenaline from the middle of the gland. That's the acute danger hormone. The major one that most people we pay attention to is cortisol from the outside of the gland, that has to do with protein and carbohydrate metabolism, blood sugar, blood pressure, immune response, all these different things that we need to adapt to changes in the environment. The gland is so important. It receives more blood per gram of tissue in the gland than any other organ in the body, including the brain.
The adrenal gland does.
Yes, per gram of tissue. Now, they're very small, but if you look at the blood flow to the adrenals divided by their weight, they get more blood than any other organ in the body.
Blood before or after the kidney?
Different. There's a different artery to the adrenals than there is to the kidneys. They sit there anatomically, but they have a different blood supply than the kidney does.
Okay.
Yeah, it's a completely kidneys
so
involved.
It's not going through the filter of the kidney.
No. That's entirely different.
Wow. How common is this problem, stress and adrenals?
Completely ubiquitous. I was at a lecture where I was giving a kind of a natural perspective on hormone therapy to doctors learning about bioidentical hormones at a conference a number of years ago. And the doctor before me was talking about this, and this is new to some of these doctors. First of all, it's misunderstood. Well, I hope we can talk about this. It's not really the adrenal glands that are the problem. It's the regulating mechanisms that get burned out in stress that have more to do with how the brain talks to the adrenal glands. But these doctors are learning about this for the first time, time and asked the presenter right before me, does everybody have adrenal fatigue? And his response was, it's very common, and the like. And me being who I am, I got up for my talk, and the first thing I said was, the answer to does everybody have adrenal fatigue is no. Just everybody in your office. So, the people who are actually out enjoying life and are vibrant and doing things, they probably don't. Most of the rest of us are from chronic stress, and I think it's the mental stress that makes it worse. And I think one of the two biggest issues, I think, are the increasing pace of life, the accelerating. You don't wait 3 months to get a letter back that you put in the mail like, 200 years ago. And sleep issues and the like, and all the mental issues, and maybe even electromagnetic type of environments and all that may also put more stress on them.
All right, so how do you know if the adrenal gland is being stressed? Does it show up in a blood test?
Not very well. This is the problem, because cortisol changes all through the day. And the normals that the labs are giving are for full-blown disease, like if you have Addison's disease like John F. Kennedy had. That's true glandular failure. That can show up on a blood test. The rest of this is dysfunction through the day, whereas your normal cortisol is highest first thing in the morning to get everything going, and then fades as the day goes on. What happens in chronic stress is the reverse. It will be low to low normal. A lot of times it's low normal in the morning, making people feel a little bit more tired. And then it will actually go up at night. When it goes up at night, it interferes with sleep. And also what cortisol does naturally is causes your body to break down protein, to turn it into sugar for you to burn. But if you're sleeping, you're not burning that sugar and you're converting it into fat, which then shows up around the fat around the middle. So it's more the clinical signs of just general fatigue, or especially fatigue that comes and goes through the day. A lot of blood sugar, what was diagnosed 30, 40 years ago as hypoglycemia, is actually just dysfunction of the adrenals in regulating blood sugar. So it varies through the day, but the whole regulating and the flow of cortisol during the day gets disrupted. That's what's commonly misunderstood by patients and doctors. We use this shorthand to call it adrenal fatigue, but it's not really the glands. It's all the regulating mechanisms that do so.
Okay, now lately we've been hearing in the conversation primarily stress and adrenal glands somewhat synonymous. Is there any other condition, medical condition, could affect an adrenal gland besides high stress?
Just usually, you see, they all affect it indirectly, I think, because any medical problem, chronic inflammation, puts stress on the adrenals. Depression actually shows high cortisol levels. A chronic infection can also show high cortisol. So all of those things can wreak havoc on the body. But there, the adrenal problem is a secondary issue reacting to the medical problem. You don't necessarily treat the adrenal per se, you treat the medical problem. But when it's the one when we have to even focus on the adrenal issue, well, yeah, you still have to deal with the primary issue, which is stress.
Right.
But there we also have some tools to use to help regulate adrenal function, which are mostly natural remedies. And then controversially, and I've used a lot of low-dose prescription hydrocortisone. This is for very sick patients. This is very controversial, but an endocrinologist named Jeffries treated thousands of patients and found when you kept the dose low, people didn't have the long-term effects of cortisone. And my experience is people actually get better over time and don't need it.
Can you have adrenal failure?
Yes, but that's usually a medical condition. And the most common cause for that back in the day was tuberculosis. For some reason, the tuberculosis had a predilection for the adrenal glands and would kind of eat them up, and people would go into full adrenal failure.
What is adrenal failure?
That would be complete lack of cortisol that you would show up. So you would see on a medical blood test, you'll see a medically low cortisol. Now, I distinguish between functionally low and medically low. But you'll see a medically low where people literally have extremely low blood pressure, debilitating fatigue to the point of can't think, can't move, are really completely debilitated. But that's actually fairly rare.
Wow. All right, so what is adrenal fatigue?
I would call that a general state of fatigue that is related to this dysfunction of the whole adrenal curve. So people are tired during the day, may or may not be more wired at night and have trouble sleeping. Probably the best way, if anybody has a fatigue problem, the adrenals are involved, in my experience, one way or another, either as a primary problem or as secondary to something else. So the detective work comes into trying to tease out what else might be going on. The best way to do that, you can do a morning blood test is what they will do typically for a cortisol. But the normals on that are so wide as, in my experience, not be helpful in fatigue, only in failure. More often, there are labs that do saliva profiles. It's the one place I'm not a big fan of using saliva for sex hormones. A lot of practitioners do that. But I do think for cortisol, it is the most helpful tool because you get 4 specimens through the day. So we see this cortisol curve that's supposed to be highest in the morning and go down. We watch what it does all through the day. So you do 4 specimens in a day. But anybody with an ongoing fatigue issue, or if they have trouble maintaining their blood sugar, so they get hypoglycemic, like me. They get really irritable, have trouble thinking, they get brain fog, get heavy when they haven't eaten, or like first thing in the morning, and it gets better after eating.
Are we overstimulating this problem with caffeine and things?
We are, and caffeine makes it worse. It becomes tricky because some people need it to function. So what I try to work with people, I say, okay, don't completely stop it for people who goes, I can't function. We want to do other things. We want to use lifestyle. We want to use herbal things that can work, what are called adaptogens. The Russians invented this term. They studied these herbs for 30 years in the athletes, the cosmonauts, and the military that help the body adapt to stress. So we want to use those things over time, sleep and the like, to make the caffeine obsolete over time.
All right, we're going to take a break. When we come back, Dr. Joel Klein's with us from Ventana Wellness. VentanaWellness.com is the website. Tremendous resource and a great organization. If you're looking for a good doctor, here's one here. When we come back, what can you do to determine whether or not you are suffering with adrenal fatigue? We'll find out when you come back in just a minute. Okay, we're back with Dr. Joel Klein from Ventana Wellness, and it's VentanaWellness.com, a great resource, the website, and so is the clinic right here in Medford. We're talking about adrenal glands and adrenal fatigue, and what is it? Now, somebody may be feeling tired, fatigued, pooped out. Right. Is that a sign?
It can be. See, the thing is, that's my job, is to tease that out, because there are all kinds of things that can cause fatigue. So, but usually the adrenals are going to be a component. In many people, they might be the major component, or at least they're going to be some component. But yes, we have to look at other hormones. We got to look at thyroid, nutritional deficiencies, even things like B12, and all kinds of things can cause fatigue. So you really have to look at the picture. I would say, especially people have this blood sugar picture, who have problems if they don't eat, or they have problems if they eat concentrated sweets and then they crash out an hour, half hour later. Certainly that's an issue. People who are tired in the morning and then can't fall asleep at night, that's going to be very commonly this adrenal dysregulation issue where the curve has gone opposite to what it's supposed to. And that's, the tired but wired kind of thing.
Okay. Those of us who are type A, high-strung, love stress, multitasking, crash at night, at least for an hour.
Certainly have adrenal stress, and when you're doing it for many years and you're starting to get tired, there's an element of adrenal fatigue for sure.
I've been getting up 3:30, 4 o'clock for over 40 years. That's just what I do. So it doesn't bother me. But can we ever feel good again?
It didn't used to bother you.
Well, the older you get, you just feel it.
That's the thing. Okay. And I think that's over decades, that's the thing. The system gradually wears down, Oh, yeah.
I can sleep anywhere at any time, any location, any position.
Absolutely. Now, if they've been stressed for your entire life, actually, one of the things that happens is babies born to stressed out or depleted mothers, a mom borrows cortisol from the baby when they're in utero, so the babies are born with stressed adrenals from day one. My mother's father died of a heart attack when she was 5 months pregnant with me.
Really?
So they're just more susceptible. So those are people who have to take better care of themselves.
Okay.
You can always get to a better position, but some people are just going to always be prone that if you get out of balance again, it's going to show up easier. They're not armored up people who can put up with a ton and, of stress and all these other things and not feel anything. But absolutely, it takes months to years, depending on how people are doing. I had one young mother actually on low-dose hydrocortisone for 5 years.
Cortisone?
Low dose, the hydrocortisone for her adrenals. She was so burned out. She had 3 special needs children and a husband out of work.
Whoa.
I had to keep her going for 5 years, but eventually she got past it and through it. But without that, she would not have been able to function.
So when you have adrenal fatigue, are you susceptible to other things like inflammation and all that?
Absolutely. Inflammation, fatigue, immune deficiency, more infections, autoimmune problems, heart disease. Is when in true medical, when they measure adrenal failure, people have increased risk of heart attacks. Allergies, all of these things will can come into play with that. Yes.
Whoa.
So it affects everything. So again, it may not be the major problem, but is typically a problem.
But
for people.
Dr. Klein, today the whole world is stressed. I mean, all of these devices is added to our stress,
right?
And it's added to our agitation. We're agitated from the moment we get up, we turn a device on, till when we go to bed at night. So we're forcing the body to do things that it wasn't intended to happen.
Right, and as one interesting kind of way out there doctor who's up in Seattle that I did some workshop with said, we're placing an immense evolutionary stress on our children.
Yeah. And
some will make it and some won't. It is a problem, and people have to listen to their bodies and possibly carve out for themselves, where do I need to draw boundaries with all this, because it is getting out of control and I can feel myself getting out of control with it.
There's a scripture that says, be still and know that I'm God, but aside from the theological implication, there is another point to that,
Absolutely.
And that is turn it off, shut it down, be still.
There's 40 years of research on meditative practices and positive health benefits, and one of the main issues is going to be this adrenal and the autonomic fight or flight part of the nervous system that accelerates aging. All of these stress hormones are designed to break us down to help us in the short run, so that we can get past whatever immediate stress it was. They are not designed to go on long term. When they go on long term, the system progressively breaks down.
All right. Let's be kind of very pragmatic for a moment. We're in a stress condition. We know we're stressed out. We don't know how to unwind our schedule. We know that our body's telling us something is wrong.
Right.
Where do you start with a patient?
Well, I usually will start with what's the biggest thing in their life that's pulling them in the wrong direction. Are they in a relationship that is abusive or doesn't serve them? Are they in a job that doesn't serve them? They're not doing the work in the world that is really in their heart because they're too busy just making a living. There's usually going to be one biggie in there that's driving them, whether it's driving them because the deeper belief is I'm not good enough, so I have to constantly prove myself.
Do more than
do more. In college, my watchword is a B is failure. I was living in that where I could not even afford to get a B, and I didn't. But that price comes back, comes to pay. So it's what are the deeper belief systems, what are those unconscious prayers that we're offering up that create these issues in our life? And then if you can get clear on that first, and then you may have to look at what is it. For me, I went back and forth with medicine several times. I thought maybe I just shouldn't be a doctor. And it took me a number of fits and starts to look at it wasn't what I was doing, it was how I was doing it, and then shifting that. So it really is what's really not working in your life to drive this. The rest of those things will come in time as you start to see what would support you in living the life that's really in your heart that you were meant to live, of what needs to happen with sleep or electronics or all of these things. They're peripheral issues, but they're important. Right. But the main thing is, what path you're walking, in my experience.
Question. So why did you go ahead with medicine?
I realized it was only what I really wanted to do, but I wasn't doing it the right way. I was just doing regular managed care, family practice, greet them, treat them, street them. Although I was getting into trouble because I knew that why people had their sinus infection was because of what's going on in their life. I said, it's not what bug is going around. If that was the case, I'd be sick every day. So what's going on in your life? And you can't do that in a 15-minute visit. But I was just pushing myself too hard and not doing what I really believed for a long period of time, what I was exposed to, that I was just treating symptoms, and actually what I was doing was enabling people. By treating their symptoms, I was covering up the consequences of their behaviors, which is what we call enabling in 12-step processes.
Okay, but at the same time, you had a conscious decision to say something's wrong here. You weren't being fulfilled as a practitioner by doing it that way.
Right, and well, I actually took a year off and didn't do anything in practice to try to figure out what I needed to do.
That's wonderful.
And I still wasn't ready to go back, but my ex-wife at the time said, you need to go to work.
Yeah.
And I started trying to do a little bit of the holistic. I had learned some things, and I had a good friend of mine tell me, he says, the good news is 40% of people get better just with the dietary stuff. So start there. And that's where I started, and then I just started listening to people, started learning more, and then intuitively, as time went on and I learned about myself and other people, I was able to put in this kind of bigger picture that I always had the ability to perceive, but I was too busy doing the right thing as to, what's making people sick.
That's wonderful. All right, now, we all know that we're stressed, we're feeling it, fatigue, we're crashing, we're probably augmenting this with sugar highs and sugar lows. We got inflammation. You bring them in, you look at them, what is the most stressful thing going on? Then what do you do medically next? Do you blood test them?
Depends. Everybody's different. A lot of times I'll do blood tests only because that's what's covered on their insurance. If I really think, a lot of times, see, I've gotten to the point where I don't even need to do the testing. I can kind of tell what's going on. If I really need to do the test, I might do a salivary adrenal panel for people. But a lot of times, I learned in medical school, freshman student, the history is 90% of the diagnosis. And I've learned a lot about what people's histories tell me as to, oh, okay, here's what's going on. We'll do some blood tests because I want to look at hormones and all that, and then we'll kind of proceed from there.
Interesting. Well, if you're tired all the time and you're worn down and worn out and you're stressed out, you may want to get checked out. And Dr. Joel Klein with Ventana Wellness, you can start by going to their website, ventanawellness.com, give them a call, and start the process. But the bottom line question is, you can get back to what you want to do.
You can, absolutely.
Okay, and that's
but
the
not
goal.
Completely back, because we're not going to start doing the same things that got you into trouble in the first place.
Well, right. Yeah.
But you can get well.
Okay.
Yes.
Good. Thanks, buddy.
You bet.
All right. We'll
Always
be
a
right back.
pleasure.
Okay.